Modern Healthcare's Top 25 Women in Healthcare is a very prestigious award. It recognizes those female executives in healthcare who are making a real difference in our industry. I'm so proud and delighted that our President and CEO, Irene Thompson, is named among these exceptional 25 women this year.
Well, I think the reality is she has been one of the most influential women in healthcare for a long, long time.
UHC is an organization that's here to serve its members, its academic medical centers, which represents many of the most outstanding organizations in various communities across the country. We're at an inflection point where we really need to develop a healthcare system that's more sustainable, adds better value, really serves its communities. And the leader of those leaders is Irene. She's had the foresight and strategic thinking to look beyond sort of the immediate crisis of the day and help our organizations think about what's necessary to transform their individual organizations to better serve their communities.
I'm not surprised that Irene was chosen for this award out of over 500 applicants. Irene is very knowledgeable about academic medicine and academic healthcare. And this knowledge has come from her experience that she's had both in Kansas and in Pennsylvania in healthcare leadership for many years before coming to UHC.
Irene's success at KU, I think, starts with the fact that she always puts the best interests of the organization ahead of her own.
I think that what's unique about Irene is that she brings together a number of qualities that you would want to see from a leader and chief executive.
She has incredible street credibility. She's been there, she's done it, she's gone through the tough times herself. She understands what it means to try to manage and change a complex organization.
She has a very strong sense of how one person might facilitate the work of another. And a lot of times staff will see the end results and not know the background work that she's done to make, whether it's a new member come on board or it's an alliance with an organization.
She focuses on getting a great team around her, good people around her, and then lets them do their job. And I think that's resonated here and has taken an already excellent organization and taken it to the next level.
When she came to UHC, UHC was already a very successful organization, but one that also required some transformation, going from a small, sort of quiet company to one that was contemporary, ready to deal with the challenges of academic medical centers now and in the future. I think the move to downtown offices are emblematic of that transformation. We're a much more contemporary, forward-thinking organization.
As a strategic leader, Irene is very generous with her time. She mentors and develops others here at UHC, within the membership, and those within her charity work. She really models the leadership that other healthcare leaders aim to be. So when I think about why Irene might have gotten this award and the characteristics of her leadership that I identify with, it's really around three things. Her courage, she challenges the status quo. Her ability to listen, she's a very active listener, and she's someone that is very inclusive. She likes to hear varying points of view. She likes to get new ideas. Evidence of this is how she's expanded not only the role of our board and having more board committees that really give more input into our programs and services and really challenge us to be innovative, but also the expansion of our membership criteria. So looking for more ways for UHC to have impact on the healthcare environment. And then lastly, she's a great communicator. She has a vision for the organization and for healthcare, and she's able to communicate that so well to inspire all of us to follow.
I manage her daily calendar, and sometimes I wonder how she's going to make it all happen. And many times I have to remind her that she can't be two places at once. Although if anyone could, it would be Irene. So I was thrilled to learn that she had been awarded this distinguished honor by Modern Healthcare, because I have witnessed firsthand her dedication to making a difference in healthcare. Many people may not know that this is the second time she's received this award.
The combination of her vast experience as a consultant, as a sitting CEO, and now as the CEO of a consortium of the most prestigious healthcare institutions in the United States, that provides a credibility that's hard to match. And so I think, to me, that's why she's been selected. It certainly doesn't surprise me, but I think she would have been successful in any industry.
This is such an important award, not only for Irene, but for the organization. It recognizes the caliber of Irene's work throughout her career, and particularly here at UHC. It also really makes the important point that UHC is a major player in the healthcare environment today.